I had 12 patients today. 4 of them were lower back pain. And now how I approach that is I think to myself, well, given the 2 options, and I keep it very simple, would I prefer you to slouch? Irrespective of the research, would I prefer you to be in a slouch position all day at work? Or would I prefer you to have a lumbar support that allows you to sit upright, but in a relaxed position?
Mm-hmm.
Yeah. So I understand what you mentioned about that research and that those muscles, say the lumbar and the QL, and they're going to be more activation through them if you hold in an upright position. And this is exactly what I say to patients. If you're going to be here and you're going to be holding yourself up, I'd prefer you to relax and slump a little bit. Okay. But given the option, if I can give you a little bit of a lumbar support at the back and you're able to relax into that, that allows those tissues then to be in a relaxed state. So again, it's like for me, what am I going to say to a patient that's sitting in front of me with lower back pain? Am I going to say, it's okay for you to slouch? It is okay if they feel comfortable in that position.
Yeah.
But then I just recommend to them to have a look at putting something in the lower back to be able to allow those tissues not to be activated. And it's funny, Chris, and you would have seen this a lot, the elderly patients that come in on walking frames. Yeah. So the amount of people I've seen in the last couple of months, lower back pain, bent forward in that stoop position for an extended period of time. Okay. Obviously they get flex through their hips, quads, psoas, in that flexed hip position, lean in forward on the toes. What stops them falling forward? You've got to activate at the back, right? And those muscles, and you feel through their muscles and they're just rock hard. And they get a lot of pain, wakes them at night, can't do anything and can't seem to get out of pain in the lower back. And I approach it, I'm looking, okay, how can I get more flexibility and mobility through the hips, quads, psoas, to allow those muscles to switch off? So I just think to myself, when they're in that position, when you get that activation through those muscles, we have to find a way to give those muscles time to not be on. And the analogy I say to people is, if I was to hold my bicep on, there's going to be a point where that bicep just goes, come on, I've had enough. And it's going to get sore and sore and sore. So yeah, there's no real answer to it. But again, I just bring it back to what do I feel is the best for that patient? What are they presenting with? As you know, a lot of lower back pain comes from disc pathologies. A lot of the time that's provoked by flexing forward, and that's the pain-provoking movement. So getting that neutral lordosis, spending that time obviously on the tummy. I give people a lot of tummy time, which gives them that nice sort of thoracic extension, gives them that nice curve in the lower back. It seems to be a nice, safe position. And then for me, my guidance around that with lower back pain is to try your best to maintain a degree of neutral lordosis in the lower back if flexion is your trigger.
Yeah.
So that's how I sort of approach it. And that would be getting out of bed, on and off the floor, is to maintain that degree of curve in that lower back, and then allow those tissues to go through that natural healing process.